Hi, this is Dr. Lynn Patrick. I'm here from Environmental Health Symposium, and it is my great honor and privilege to be speaking with Professor Gilles-Eric Seralini from France, who has been at EHS. He came to do a keynote lecture in 2016. He's coming back in this year, 2019, in April. We're very honored to have him. Dr. Seralini, welcome to this webcast. I understand that you're going to be talking about two very important and somewhat related subjects. Do you want to tell us what you're going to be talking about?
Yes, first of all, I'm really honored and thankful for the invitation to speak again at this Health and Environmental Health Symposium, because it's a very huge topic today concerning public health in general. We discovered that more and more chronic diseases are in fact due to our toxic load, fossil toxic load, not only the toxic load of all the metabolites that we have, too many sugars, too many lipids, etc. But we've discovered in my lab a fossil toxic load, which is due to petroleum residues, which are mostly pesticides and plasticizers. So these are interfering with our hormones. We have demonstrated that at a molecular level, but also at a cellular level for human cells, human baby cells, but also in vivo on mammals, and especially on rat labs. And today, what we have done is very original. I'm talking first about the symposium on endocrine disruptors. We've took 177 endocrine disruptors that are recognized by WHO as endocrine disruptors, and we've made a search to know if there were also nervous disruptors. And we've demonstrated that 98% of these 177 molecules known as endocrine disruptors are also nervous disruptors. So they are interfering with the nervous system, including the promotion of Alzheimer's or Parkinson's diseases, for instance. And we can say that they are not only endocrine disruptors, but spans of life. So that means that they are disruptors of life in general. You know, life is due to cell-cell interactions inside our bodies. And we've discovered that the topic of endocrine disruption was much more bigger than supposed. So that means that these molecules are in fact interfering with any cell-cell communication system, like spams are interfering with our computer devices.
And so, Dr. Seralini, let me just ask a question, because this is very powerful information. We now may have to redefine endocrine disruptors as...
I call them ENDs. That means endocrine and nervous disruptors, and because they are also the end of life. So they are ends in themselves, and they interfere like sand, you know, little grains of sand in our cells and in between our cells, because we have only two means of communication between our cells. Either the electric system, which is in fact due to the nervous system, or the chemical system, which support the endocrinology and the endocrinological system. So they are, you know, two sides of the same coin, and endocrine and nervous disruption. So they are really ends. So today we teach around the world that in fact all endocrine disruptors are nervous disruptors, and we should call them ends. And the regulation, the agencies which are in fact too much dedicated to serve the big companies are have missed this very important point, and this is why there are some debates about their effects. They are always underestimating the real effects on the chronic health. So this is my first point. And then I say to all the patients and to all my students, we cannot stop at this point, because we are just making the people sad, saying that all these pollutants are in fact interfering with the cell-cell communication in our bodies and bioaccumulating and having combined effects. So we must find a way to get rid of them. And this is why we have understood their mechanism of action. They not only interfere with our receptors and hormonal receptors, we knew that, but they interfere with the basic cell-cell communication, and we have to find the enzymes that can detoxify them. And we found that these breathing enzymes inside the deepness of the cells are in fact the cytochrome P450 and others, and these enzymes can be stimulated by aromatic plants because and aromatic herbs, because these aromas also are the sexual hormones of the cells, and they are also the breathing hormones.
So, Professor Seralini, you're going to be
detoxification of ants.
So you're going to be speaking to us about your research on aromatic plants and their ability to detoxify what you're now calling endocrine and nervous system disruptors. Yes, that will be.
That's right. We have found that we need a combination of these plants, not too many, because it's like a hormonal system. So if you put too many, it doesn't detoxify well. You need enough, but you cannot inhibit the system, because otherwise it's like a pill effect, you know. If you have too much hormone, then you have a blockade. If you have too much detoxifying products, you have a blockade of the detoxifying system. So we need enough aromatic plants to get the desire of, to get the saliva, to get the desire of the plate, to get the desire of the drink. And this will stimulate, and we rather trust fresh herbs today, but we can also do that with some desiccated plants. But I will say more in this workshop on the Sunday.
This is very exciting information, because on my end, you know, I teach environmental medicine to physicians. It's the same thing. You cannot propose a very serious problem without proposing an equal solution to that problem.
And you know what? I give you a secret before finishing. It is not only theoretical, because we were successful in detoxification of rats after having them polluted by some pesticides like agricultural workers. And you know what? When we've detoxified them, the first thing they recovered, the first sign was their libido.
The sex drive, yes.
Yes.
And that's a very good sign, because it means that the estrogen, testosterone production or utilization pathways have been unblocked.
Yes, because the sand, the sand that represent the endocrine and nervous disruptors, the ants, stick to all these systems and put down the libido.
Right, exactly. And we're going to be talking about that earlier on in the conference. So I think everyone will be primed for your message on Sunday. Well, Professor Seralini, it's been a pleasure. I am so looking forward to seeing you again. You're going to be giving 2 lectures at EHS 2019. And I think you will be you know, the hit of the conference. I'm really looking forward to it.
It will be a pleasure to be with you.
Yeah, safe travels to you, and we'll see you soon.